Welcome back to Neutralizing COVID, the monoclonal antibody story, the podcast where we unpack the science, strategy, and real world impact of monoclonal antibodies in the fight against COVID 19. I'm your host, Dr. Shikha Agrawal. Today, we'll tackle an emerging frontier in COVID research with the role of monoclonal antibodies in long COVID. What do we know? To help us understand what we know and what we don't, Dr. Ashwarya Chaudhary, a nanomedicine researcher, joins us again today. Welcome back, Dr. Ashwarya.
Great to be here, Dr. Shikha. Long COVID is such a complex and evolving topic, so I'm glad we are we're taking a closer look at it.
To begin, could you define long COVID from a clinical and scientific standpoint and explain why it presents such unique challenges for researchers?
Long COVID, also referred to as a post-acute sequel of SARS-CoV-2 infection, involves a range of symptoms that persist weeks or months after the initial infection has resolved. These symptoms can include fatigue, cognitive difficulties, shortness of breath, and many others. The challenge is that a long COVID isn't one uniform condition. It likely involves the multiple mechanisms: persistent inflammation, immune dysregulation, microvascular challenges, possibly even viral reservoirs in certain tissues. That complexity makes it difficult to pinpoint one specific treatment approach.
Given that, where do monoclonal antibodies potentially fit in?
Traditionally, monoclonal antibodies have been used to neutralize the virus during early infection. The idea is to reduce viral replication and prevent the immune system from becoming overly activated. Some researchers have proposed that if you treat someone early, especially someone at risk of persistent symptoms, monoclonal antibodies could help reduce the chances of developing long COVID. Others are exploring whether viral persistence in tissues could be a driver of long COVID, and if so, whether targeted antibody therapies might help eliminate the residual virus.
Is there any evidence that monoclonal antibodies can actually prevent long COVID?
There have been observational signals suggesting that individuals who receive monoclonal antibodies during the acute infection may have had a lower risk of developing long COVID symptoms. However, these findings are preliminary and based on limited database. What's important to emphasize is that monoclonal antibodies are not currently approved or authorized specifically to treat or prevent long COVID. Their primary use remains in the acute phase of COVID-19, especially in the high-risk patients.
What about using monoclonal antibodies after the acute phase once symptoms of long COVID are already present?
That's much more speculative area. If long COVID is being driven by residual virus, theoretically, a monoclonal antibody that targets the conserved parts of the spike protein could help clear it. But so far, we don't have clinical trial data supporting that approach. In most people with long COVID, PCR and antigen tests are negative, which complicates the case for a virus directed therapy like monoclonal antibodies. There's also the possibility that long COVID involves immune dysregulation that no longer depends on viral presence, which means a neutralizing antibody wouldn't be effective.
Have there been any clinical trials specifically investigating the role of monoclonal antibodies in the context of long COVID?
There are some early stage studies and case series exploring the antiviral and immune based therapies for long COVID, including the monoclonal. But we are still in the early phases of gathering rigorous evidence. We will eventually see trials that combine the monoclonal antibodies with anti inflammatory or immunomodulatory agents, especially if a subset of long COVID turns out to involve lingering viral antigens triggering immune activation.
What's the most responsible way to talk about monoclonal antibodies in this context?
The key is to honest about what we know and what we don't. There is currently no established monoclonal antibody therapy for long COVID, and we don't yet have data showing that using them after the acute phase improves the outcomes. That said, if future research confirms that the viral persistence plays a role in some forms of long COVID, monoclonal antibodies may become part of a broader therapeutic strategy. But for now, their role remains exploratory.
So, looking ahead, what are the priorities for research in this space?
We need a well-designed prospective trial to assess whether early intervention with monoclonal antibody has any impact on a long COVID risk. We also need biomarker-driven studies to identify which patients might benefit from virus-targeted therapies versus those whose symptoms are driven by immune or neurological pathways. It's likely that long COVID isn't a single disease, but a collection of overlapping syndromes. And understanding that complexity will be key to designing effective treatments, whether that includes monoclonals or not.
A lot to think about and clearly a lot more to learn. Dr. Aishwarya, thank you for helping us break this down clearly and responsibly.
Thanks, Dr. Shikha. Always a pleasure to join these important conversations.
Well, that wraps up this episode of Neutralizing COVID, the monoclonal antibody story. Long COVID remains one of the pandemic's biggest unanswered questions, but science is catching up. Dear audience, we appreciate you tuning in. If you learned something new today, give us a follow and send this episode to a friend or a colleague. Until next time, take care and keep exploring science.